how do you know when it's time to change treatments?
Well, I think really two things. One is if we aren't meeting our goals like we just talked about, but the other aspect of that is if we are incurring toxicities that are just not tolerable to the patient, and that's a reason to change therapy always.
Many patients, of course, worry about disease progression. Are there key predictors or tests for progression that patients should know about?
This is a key area of investigation currently, right? I think one of the things that patients say to us so often when we meet them is, what's going to happen to me, right? Right now we don't have great prediction tools. We can say on a population level, well, there's X% of chance of progression at 15 years. That's useful if you're talking about a population. That's not really useful if you're talking to an individual, because if I say to somebody, well, there's a 20% chance of your disease progressing to leukemia, it doesn't really make a difference. That's a kind of a meaningless statement, because if you're in the 20% who progress, it's not a relevant statistic anymore. It's sort of a binary thing. We've got to do better at developing this. This is something that the MPN Research Foundation is really heavily invested in trying to identify predictive biomarkers. Because if we can do that, then perhaps what we can do is say to a patient, this is really what we think your actual risk is. And then the next step is asking the question, if we intervene early, can we prevent that progression from occurring? So that's where I think we need to go. We aren't there yet, though.
Yeah. What signs or symptoms do you look for that may indicate that the disease is progressing?
I think, it's the blood counts are often the canary in the coal mine, regardless of the disease. They can tell us if ET or PV is progressing into MF, or whether MF is progressing to more of a leukemic phase. Changes in symptoms sometimes can be a harbinger of disease progression. So patient who, for example, was doing really well and now is having drenching sweats and losing weight. So those types of symptoms are a sign. And then, physical exam findings like the size of the spleen, if it's increasing, all of those things together give us a hint about progression.
Yeah. Well, is there any way to prevent progression?
That is the million-dollar question, right? And again, that's where we ultimately need to be, right? We want to be able to intervene to a point where patients don't get that sick, right? Could we, be amazing if we've come to the point where we can intervene early and nobody progresses to late stage MF, nobody gets leukemia. And I think that's a worthy goal. That's not something that we should think is too lofty of a goal. That should be our ultimate goal here. A number of groups are investigating this exact question. It's complicated and it's going to take time, but I think that's a worthwhile investment.